So today I want to talk to you about mother's guilt, and that is a topic that always comes up. And today I want to let you know what someone as a Clefty feels like towards her mother. So stay tuned. I never in my entire life ever thought to blame my mother for my cleft lip or palate. As a matter of fact, I was very grateful that she took care of me and she raised me and didn't give me up for adoption. She didn't quit. She didn't freak out and run away. She didn't leave me on a doorstep. She didn't try to euthanize me. I'm very grateful that she took responsibility for me and raised me to be the person that I am today. Doctors, professionals, scientists have been trying to figure out what exactly causes cleft lip and palates for hundreds of years, and they can't figure it out. So how is a mother who probably has never heard of this birth defect before diagnosis, how are you expected to be careful? How are you expected to know what causes it? How are you to blame? You're not. There is nothing that you could have done to change anything. So now you have gotten the news that your baby is going to be born with a cleft lip or palate or both. Or your baby's already been born and you've been surprised. And it can take you by surprise. And it's okay to feel like it's going to be hard to cope. Don't feel guilty for asking that question, how do I cope? Because you're in for a lot of work. Yeah, it's hard on the baby, it's hard on the individual who is born with a cleft lip or palate, but the person who takes care of them, that's a lot of responsibility, that's a lot of work, that's a lot of sleepless nights, and that's a lot of worry. So don't feel guilty if you need to talk to somebody, if you feel like you're having trouble coping. Don't feel like you're taking anything away from that baby, because you're going through this just as much as the baby is. So it is going to be tough on you. And there is going to be challenges. Challenges for you, challenges for the baby. And it's not something that is going to come easy. But the one thing I can tell you is that no amount of you worrying is going to change what your baby is going through. No amount of my mother's worry ever changed what I was going through. The more she worried, the more I worried. And you think a baby doesn't worry, they pick up on your feelings from birth. They pick up on the humans around them, they pick up on the emotions, and they feel those emotions. So if you don't want your baby to be sad, don't be sad around your baby. If you don't want your baby to be nervous, don't be nervous around your baby. If you don't want your baby to feel sorry for themselves, don't feel sorry for your baby. These are things you need to do to help nurture your baby and make your baby strong. Because as a Clefty, we have to learn to adapt constantly. Things are constantly changing and we're constantly adapting. Now, it has been suggested that smoking could be a factor. I'm here to tell you that I had 3 healthy boys. I smoked. I'm not proud of it. It was back in the era when smoking was the thing. It was not a big deal. But I smoked with all of them. Not one of them were born with a cleft lip or palate or serious birth defect. So I tend to disagree with that that theory that smoking had something to do with it. Now I do know that I was worried. I didn't have a lot of information. I was not educated well. I basically learned from what I went through. But I'm learning new things today about cleft lips and palates and syndromes that go along with it. But when I was pregnant, I wanted to, I knew that there really wasn't anything I could or couldn't do, but I wanted to be sure that I didn't make anything worse. So I studied how a baby was born and how it formed, and I learned that the baby basically forms as two separate halves, and in the end of the first trimester, between like 6 and 8 weeks, the body fuses back together. And it's at that time when a cleft lip or palate could actually take place, because the formation of the two halves not coming together properly can cause a gap or a cleft. So what I did was I made sure that I was careful not to take any heavy medications in my first trimester. I tried to stay away from any antibiotics, any serious drugs, and I limited my over-the-counter drugs like Tylenol or pain relief to as little as possible, just as a safeguard. Obviously, I didn't genetically pass it on to any of my kids. Now, I have an older brother and sister, neither of which were born with a cleft lip or palate, and none of their children were born with cleft lip or palates. As far as I know, even in my cousins, I don't know of anyone else in the family who has a cleft lip or palate that is blood related to me. As far as I know, neither my brother's wife or my sister did anything special to try to avoid medications or anything of that sort. As far as I know, they just went through a normal pregnancy and none of their children were born with clefts. So I'm not going to discount the theory that cleft palates run in families. I'm not going to try to discount the theory that it could be outside influence. But I'm trying to illustrate the fact that different people do different things and different results happen. So there really is no clear-cut evidence of what causes cleft lips or palates. There's a lot of speculation. The one thing that I would advise anyone who has not gotten a diagnosis of a child with cleft palate, but is worried about it, and this spans not just cleft palates, but any kind of deformity. Don't take any drugs if you can possibly avoid it. Don't take any medication for morning sickness if you can avoid it. Of course, if it's a life or death situation, or if it's a serious medical condition, you have to make a choice of you remaining healthy, because if you get too sick and don't take your medication, you could it could affect the formation of your baby. So you have to stay healthy, and you have to talk with your doctor. But if it's for something simple like a headache or a little stiffness or something like that, if you can avoid taking pain medication, do that. Take a nice hot bath. Find holistic remedies for small conditions. But when it comes to the sake of your health, like a condition like diabetes, naturally take your insulin or take whatever the doctor tells you to take for whatever condition you have. You have to weigh those options, and you have to stay healthy for your baby. So now you've had a chance to absorb the information and to come to terms with what you may be facing in the future. What I want to tell you is that no two clefts are exactly alike. They're like fingerprints. They are different. Each baby can be born with just a cleft lip, just a cleft palate. The degree of severity could be small, could be large. The palate could be clefted. There could be a gap in the hard palate, which is the area of the palate that is in the roof of the mouth. As you go back towards the throat, that is the soft palate. The cleft could actually be back in there, or it could extend from the front to the back. The cleft could be on one side of the lip or the other. It could actually be on both sides. The cleft could also run the full length of the palate, hard and soft. And the varying degrees are dependent on the child and the severity of their clefts. So to try right now, before the baby is born, to try to pinpoint and get yourself ready for all scenarios is really not necessary. It's actually not a good use of your time, because worrying is never good for a developing embryo. Worrying is never good for a mother. So right now, get yourself a little familiar with the different types of clefts there are. Maybe, find out what the 5 most common syndromes that go with clefts are. But I can tell you, if I had one of those syndromes, if I have one of those syndromes, I don't know. All I know is I had a cleft lip and a cleft palate. My hard palate was open, and it's a small gap. I'm missing bone. I've never had bone reconstructive surgery, and I've done just fine without it. And as far as I know, I have sinus issues. I have a deviated septum. A deviated septum simply is the canal going from your nose into your sinuses is deviated. It's not straight. It's to one side or the other, which can affect the flow of drainage from the sinuses into the throat or into the nose. So I have a deviated septum. I've never had surgery to repair it. If my sinus infections are part of a syndrome that has a name to go with my cleft palates, I don't know. I've just learned to deal with each situation as it came up. So the next question is, now what? Now what do you do? The first thing you need to do is relax. Get a hot cup of coffee, hot cup of tea, whatever it is you like to drink. Take a relaxing bath, and just rest. Just rest. Give your body some time to recuperate from the stress of the news that you've just received. And then, once you've had some time to relax, then take a look around the internet, watch some videos, but be careful. Don't go to any crazy places. And don't read the comments. If you're worried about people insulting you or your child, if insults bother you, if you don't have a tough skin, don't read the comments. Because a lot of these videos are open to everybody. They're not private. So some of the comments may be mean and mean-spirited. And I personally don't have a problem with people making rude comments, because usually they're people who are scared. They think, oh my God, I can catch this. You can't. If you weren't born with it, you're not going to get it. It's a birth defect. But some people just don't understand it. So I'm here to help people understand, whether it be someone with a cleft, someone who is having a child with a cleft, someone who knows someone with a cleft, someone who loves someone with a cleft, someone who hates someone with a cleft. If you are curious about what we go through, that's what I'm here to do. I'm here to answer those questions. So when you go to watch videos, it's best not to read all the comments if you are worried about being insulted. So right now, the best thing you can do is just relax. Take some time to allow your body to de-stress, recuperate from all the stress that you've been under since you've received the news, and don't stress. It's not the end of the world. There is 1 out of every 700 individuals are going to be born with a cleft palate. And so there's a lot more of us than people realize. And we're starting to come out. We're starting to talk to each other. We're starting to help each other out. And I think if I can help just one person, I'll be happy. It'll be worth any nasty comments I can get. So, I think that's really all that I can give you right now without getting too deep. And watch my other videos. If you found this helpful, watch my other videos. I'll be coming out with one every week, and until I cover everything I can think of. So this is my parrot, Ruby, and she is responsible for that loud clicking noise you hear a lot of times when I'm doing my videos. And she doesn't like to be not paid attention to, so, yeah, and she likes to join in on the conversation. So I decided to bring her out and go ahead and try to do this video and see how it turns out. But,